Good morning. I'm calling to order this hearing. This is a public oversight hearing of the Committee on Aging and Community Affairs. I'm Council Member Yvette Alexander. I represent Ward 7, and I'm also the chair of this committee. And next, Mr. Alan M. Dinsmore, the vice chair of the Elder Think Tank.
Thank you very much for the opportunity to testify this morning. I've submitted a more detailed statement for the record, and I will excerpt to stay within the 5-minute period. The Elder Think Tank of the Gay and Lesbian, Bisexual, and Transgender Community Center of the D.C. metropolitan area appreciates this opportunity to provide testimony in support of the District of Columbia's Office on Aging. Our mission is to provide support, education, and advocacy for aging members of our community and those who provide services to them. We wish to thank Dr. Clarence Brown and the staff of the D.C. Office on Aging for including our population in the 2011 through 2013 draft state plan. This monumental step outlined in the plan does ensure that we now have the potential for becoming equal partners in both service and also for recognition of the service needs of our community. The DCOA has also taken 3 very important initial steps which we support. One is including a groundbreaking plan for the measurement of data on aging of our residents through the C-STARS data collection form. That is under test at the present time and we hope will be implemented in just a few months. The second is in their questionnaire regarding satisfaction levels of services with the DC Office on Aging and the Senior Network. They have also, for the first time, asked the question, are you gay or lesbian if you're responding to this? That's extremely important. And finally, results from the telephone survey conducted by the DC Department of Health and Behavioral Risk Service Surveillance System shows for the first time that the respondents to this community-based survey, about 7% of the adults have identified themselves by sexual orientation other than heterosexual. We hope that this new collection process will allow us to have more accurate data because that's the question everybody asks, and they ask it of all populations and every segment of the population. How many are there? But we also need to remember that large numbers of our community, particularly over the age of 75, grew up in a time when everything had to be hidden. They do not respond. We are very encouraged to see this first effort because beginning to involve people at lower age levels means that when the questions are asked, when you get to be 75 years old, you're probably going to answer them in a way that someone presently in that age cohort would not have said. Unfortunately, people don't respond, and the reason is that they find that many providers of services consider that their clients include LGBT elders who have not revealed their sexual identity. Very few agencies have any training in order to help staff and also other people who are taking part in these services understand these situations. I'll give you just one example. If you have a resident of an assisted living facility at Valentine's Day, everybody puts up the board for my special Valentine. Is Anna going to put up the picture of her partner of 40 years? Probably not. That's very important. The DC Office on Aging has also proposed very significant steps in remedying some of these problems through their draft plan, including convening a working group within the Senior Service Network to address these issues by September the 30th, 2011, establishing a volunteer peer advocacy group for LGBT people in continuing care facilities and nursing homes, also by September the 30th, 2012. The Elder Think Tank is ready to help implement these groundbreaking initiatives, and as vice chair of this committee of the Gay and Lesbian, Bisexual, Transgender Community Center of Metro DC, I am here to pledge and reiterate our support. Finally, we do want to draw the attention to the committee to the startling data on HIV, AIDS, and aging. The DCOA draft plan points out that persons over 50 years old account for 1/3 of the 15,120 people living with AIDS in D.C. Nationally, 77% of people in this age category have 2 or more other medical conditions, including depression, arthritis, hepatitis, and neuropathy. It's very important that we begin also to take first steps at looking how we can more adequately serve these seniors within our networks. Thank you for the time.
Thank you. And we do have to keep that in mind. And what I'm going to ask later today, I also have oversight of the Office on GLBT Affairs, and I'm going to ask you now to take this opportunity. Have they engaged your organization as well? Because I think what we need to look at are interagency collaborations, also Department of Health with regards to the senior population. I think when we engage other agencies, we can obtain additional resources. Have you reached out to either of those agencies, and do they have a specific interest in the senior population?
Well, in fact, just last week, under the auspices of that office, we were able to meet with the deputy of the Department of Health and also with the director of mental health services to raise a number of these issues, begin the conversation, begin the dialogue.
You know, they bring it up. I know Dr. Vigilance has spoken about the increase in the persons over 50 with HIV/AIDS, and they need the education as well. So we need to press that. What about the Office on GLBT Affairs?
Well, the Office on GLBT Affairs has been very supportive. In fact, they were the ones who arranged that meeting for us and for other service providers in the community. So that was really the first time that there was an opportunity to engage at that level.
Do you think, and I hate to, separate one part of our population out, but in this instance, because you mentioned some really sensitive issues for our GLBT community and senior homes, is it, do you think that we need a separate location for people to feel more comfortable, or we just need to educate everyone about our growing GLBT population?
I think the education has to go to everyone. There is an organization that is very much involved in initiatives to try to pull together the aging services. The Aging Research Initiative and the Aging and HIV Research Initiative in the United States is doing that. They've also had some sessions here in the District of Columbia. They're trying to do this nationwide to see exactly what kind of education materials people will respond to.
Are there any nationwide, any senior homes that just cater to the GLBT community?
No.
No. Okay. Thank you. Well, thank you for your testimony. And next we'll have